We've come up with an idea which is doable and that will have an immediate impact on the ground. It's called Chorus. Both in Arabic and English, chorus means voices singing together. And what is the pitch? Well, we all know through UN reports from Human Rights Watch, that sexual violence, the targeting of women and children, has become one of the most horrific aspects of the conflict in Syria. And we want to work to have UN Security Council Resolution 1325 applied in an innovative way. I think everyone knows that the conflict in Syria is not going to end anytime soon. There's no political solution on the horizon. Meanwhile, there'll be more and more female and young girls being attacked through violence. And so therefore, we also realize that humanitarian actors, the UN, main NGOs, cannot access parts of Syria where a lot of them are victims. So we must innovate. We must create a digital humanitarian project that can be applied with low-tech uses. So our solution, Chorus, is a digital platform for the protection of women and girls in Syria. Now, what's the problem? Well, it's quite clear that the Syrian regime and Daesh, also known as the Islamic State in Iraq and Syria, are ordering soldiers and their fighters to systematically rape and maim women and girls at checkpoints, detention centers, and military raids. There are also cultural taboos that prevent women who are victims, the survivors, to come forward, to meet with medical practitioners and seek what they need to have, psychosocial assistance, medical assistance. We also realize that there are a lack of resources. Lots of the health infrastructure is being destroyed. Communication systems have been down. Now, we propose to, in 2 phases, to 1, support survivors directly, immediately, and phase 2, empower women and girls with knowledge to take practical steps to reduce dangers to themselves. That is how we will impact and hack into conflict and make a difference. So we'd like to pass to my colleague to talk about voices from the field.
So we know that UN agencies, Amnesty and Human Rights Watch have documented sexual violence in Syria, but that's not enough. Our evidence base for this portal is through key voices, key Syrian voices from the field. The ground tells us that, according to a citizen journalist in Dara that we spoke to yesterday, we know that regime forces and non-state actors are being ordered to systematically rape and sexually abuse women and girls at checkpoints, detention centers, and during military raids. We also know that we're operating within a cultural taboo of reporting sexual violence. According to a field source, he tells a story of a mother and daughter who were arrested at a regime checkpoint, detained and raped at a detention center. After 4 months, the mother escaped and only reported gunshot wounds. And only later was it revealed that she had been raped. Medical practitioners need to be trained to identify survivors of sexual violence because in most cases, they are not self-identified. According to a study conducted on the ground with 90 focus group discussions with women in opposition-controlled territories of Syria, there is a need to establish effective services for sexual and reproductive health and effective response to sexual violence. Medical facilities in opposition-controlled areas are low capacity and lack effective services for gender-based violence incidences. According to a gynecologist we spoke to on the ground in Dara, medical professionals are ill-equipped to respond to sexual violence. They lack resources and expertise on effective documentation and an emergency response. And finally, according to a field source with a women's group in Syria, we do have a network of local practitioners and activists and women's groups who are ready to implement what we propose today. All they need is our support.
Thank you. So the big question really is what is Chorus and what is our solution? What we're proposing is a big data, what I would like to call big data digital glue. It's designed to help hold society together and to reduce the marginal utility of the use of violence against women as a weapon of war. The way it does this is by collecting data through a whole host of different systems. So what we do is we don't try to reinvent the wheel. We take data from all these open source sources, as well as participants on the ground and the network that we have on the ground. We'll take this data, aggregate it, merge it, bring it together, and then make it meaningful for participants, being practitioners as well as women who are located within these conflict zones. So this process is basically going to enable us to do things like, for example, identify zones of danger and identify zones where women will be safe. And also provide a whole host of support services to practitioners on the ground. Clearly, we've identified some risks with respect to this, and these risks are basically regarding the anonymization of the system, which we've considered. There's also a cultural stigma with respect to the reporting of rape and violence against women, and we've dealt with that by really focusing on discussing this with practitioners who have access to that data.
So I'm getting to mention that we have to close down in 30 seconds. So doability. We can do this now with low cost, low resources, and the need has never been greater. And we do meet the cred. And most importantly, how to disrupt. Well, I think the most innovative part of this is that if we can take data, learn about where women are being targeted, learn if there are certain checkpoints in cities where 80% or 90% of people are victims, we can map this out and allow that future victims will use this data through visualization methods on the apps and websites we create to actually better prepare themselves to protect themselves in practical manners. Thank you.